What is cancer? Well, hopefully after my speech on cancer, you'll be able to know the answer to that question. Cancer is the term used for the disease in which abnormal cells divide without control and are able to invade other tissues. Cancer cells can spread to other parts of the body through the blood and lymph nodes. Cancer is not just one disease, but many diseases. There are more than 100 different types of cancer. All cancer begins in cells, the body's basic unit of life. The body is made up of many types of cells. These grow and divide in a controlled way to produce more cells, which, when the cells become young or damaged, they die and replace with new cells. There are many different types of cancer, like I already mentioned, but the four most common cancers are breast cancer, colon cancer, lung cancer, and prostate cancer. Breast cancer is the most common cancer in women, being responsible for almost 20% of all cancer deaths in women. It's ranked second after lung cancer. It has been said that roughly 180,000 women are diagnosed with this disease every year, of which 44,000 will die. For every 100 women that have breast cancer, 1 man will be diagnosed with cancer. The disease is more common in women after the age of 40. Different causes and risk factors of breast cancer are history of breast cancer of the first degree relative, history of breast cancer in the same patient in the opposite breast, onset of menstrual in early ages, late onset of menopause, radiation exposure, high-fat diet, obesity, first pregnancy after 30, and very tall women. Some of the signs and symptoms of breast cancer may be a lump in the breast, or notice abnormal discharge from the nipple, or fell thickness or smell of the skin or nipple. Colon cancer is the third most cancer in women and men. Estimated 131,000 Americans are diagnosed with this disease every year, and roughly 55,000 die every year. The average age of the time of diagnosis is between 60 to 65 years of age. The older we get, the higher the risk of colon cancer. If your first degree relatives have colon cancer, then your risk of developing the disease increases. The signs and symptoms of colon cancer are blood in the stool, diarrhea, constipation, bowel obstruction, abdominal pain, pelvic pain, weight loss, and loss of appetite. Lung cancer is the second most common, affecting both sexes. Roughly 180,000 Americans were diagnosed with this illness every year. Since 1987, lung cancer has been the leading cause of cancer death in women. The average age of patient with lung cancer is 60 years of age. It is very common in African American and Hawaiians. Cigarette smoking is the number one cause of this disease. 14,000 Americans die every year from lung cancer. Prostate cancer is the most common cancer in American men, with roughly 185,000 men diagnosed in 1998 and claiming 39,000 lives from it. Most common in men over 60 to 65 years of age, and more common in African American men. The cause of this cancer is unknown. There are certain factors of this disease, though, and they are increasing age, African American men, family history of prostate cancer, cigarette smoking. Some signs and symptoms of prostate cancer are difficult in urinating, burning while passing urine, increased of urination, blood in urine, bone pain, and swelling of the legs. Children can get cancer in the same parts of body as adults, but there are differences. Childhood cancer can occur suddenly without early symptoms and have high rate of cure. The most common cancer of children is leukemia. Symptoms and treatment depend on the cancer type and how advanced it is. Treatment may include surgery, radiation, and/or chemotherapy. Cancers in children are often hard to recognize right away because the symptoms can overlap with more other illnesses. Children often get sick or have bumps or bruises that are early signs of cancer. You should look for these symptoms that do not go away: unusual lump or swelling, loss of energy, easy bruising, and ongoing pain in one area, limping, illnesses that doesn't go away, frequent headaches, and weight loss. Cancer has affected my family in many different ways. When I was in the fifth grade, my uncle got diagnosed with lung cancer. He got diagnosed with cancer that didn't give him much time to live. However, he lived longer than they gave him. He went through the whole chemo thing and lost all of his hair and got skinnier, but could not make it through the battle of cancer. My uncle was a very healthy man who didn't smoke and was very active. None of the family understood why he was the one that got cancer. My uncle ended up having to go to Texas for treatment, where my family flew down with him to be with him. He went through the treatment and the surgery that they had to give him. However, shortly after my family left the hospital after his treatment, he got really sick and ended up passing away. Still to this day, no one of my family is for sure why my uncle died of cancer. He didn't do anything like smoke cigarettes or drink. However, we will never know what caused him to get the cancer. When I was in the ninth grade, my grandma was diagnosed with cancer. I'm not sure what cancer they said because she had it so much throughout her whole entire body. My grandma didn't live very long after she was diagnosed with cancer. It was around Thanksgiving that we found out that she had it, and she died at the end of January. My grandma also went through chemo and didn't take it very well. It seemed like she got really sick, lost all of her hair, and she just couldn't fight the battle. The difference between my uncle and my grandma was that my uncle was only 35 years age, and my grandma was 74 when they died from cancer. You really never know if you're going to get cancer until you get it. There isn't anything that is going to stop you from getting it. You can be the healthiest person in the world and still end up with cancer.